Hello friends. So let's start the topic for today, pectoral muscles. Today we will be discussing about muscles of pectoral region. Pectoral region means the anterior chest wall. This anterior chest wall contains the muscles pectoralis major, pectoralis minor and one small muscle subclavius. This region also contains serratus anterior muscle, but that we will discuss some other time. So today we will be discussing about pectoral muscles, pectoralis major, minor and a small muscle subclavius. We will discuss the origin, insertion, innervation and action of these muscles. So let's start the journey of pectoral muscles. So the first muscle is pectoralis major. So here you can see the muscle pectoralis major muscle, which has been drawn like it is a big muscle starting from the sternum, clavicle, costal cartilages and going up to the humerus. So we have to know the origin and insertion of this muscle. So the pectoralis major muscle originates first from anterior half of the clavicle, from the anterior surface of the medial half of the clavicle. Also this muscle originates from anterior surface of lateral part of sternum. So this is the sternum. So anterior surface of the lateral part of sternum. So from here it originates up to the sixth costal cartilage. It also takes origin from some of the costal cartilages, from second to sixth costal cartilage. Second to sixth costal cartilage. Then the fibers is going and inserting to the lateral lip of bicipital groove. So this is the bicipital groove here. This one is the bicipital groove or intertubercular sulcus. So pectoralis major is going to insert on the lateral lip of intertubercular sulcus or bicipital groove. So we have studied the origin of pectoralis major. So origin is from anterior surface of clavicle. How much? Medial half of anterior surface of clavicle. Second, we have studied anterior surface of lateral part of sternum. So sternum up to sixth costal cartilage. Also takes origin from second to sixth costal cartilage. Not from the ribs. This has to be remembered. Takes origin only from costal cartilage. Then where they are going to insert? To the lateral lip of bicipital groove. Lateral lip of bicipital groove. Bicipital groove or intertubercular sulcus. So this is the origin and insertion of pectoralis major. But the most important thing about pectoralis major, here you can see the fiber is going to be twisted here. Here at the lower border you can see fiber is going to be twisted. So this is one of the spiral muscle where the lower fiber is going to insert up, higher up on the bicipital groove lateral lip, and the upper fiber is going to insert lower down. So there is a spiraling of the pectoralis major fibers. So this is very important thing. So let's discuss about this spiraling arrangement. So we have studied up to this the different attachments of the pectoralis major. We are going to discuss about a spiral arrangement of the fibers. So as you have studied, clavicular fiber is uppermost fiber. So these are the clavicular fibers. Now you have studied the fiber coming from a sternum. So this middle one is manubrial fiber and sternal fiber up to fifth costal cartilage. So these are the middle fibers. So these are the middle fibers. Now the lowermost fiber coming from sixth costal cartilage and also from aponeurosis of external oblique abdominis. So below is one muscle, external oblique abdominis. So the sum of the fiber also comes from aponeurosis of external oblique abdominis. So these lower fibers are going to insert higher up and forming the posterior lamina of the pectoralis major muscle near the insertion. So if this is the bicipital groove and the lateral lip of the bicipital groove, so these muscles is going to insert here on the bicipital groove forming posterior lamina, lower fiber. What about the upper fiber? So upper fibers, these clavicular fibers are going to form the anterior lamina, but it is not inserting much above. Posterior lamina is inserting much above. Similarly, these manubrial and sternal fiber is going to insert just below the clavicular fibers. So at the lower part you can see there is twisting. So twisting is there. So a spiral arrangement is there. A spiral arrangement is there forming anterior lamina and posterior lamina. And which lamina is above? Posterior lamina is inserting above as compared to anterior lamina. So this is very important regarding the insertion of pectoralis major. Now let's move further. Here in this picture you can see pectoralis minor muscle. So we can see the pectoralis minor muscle is originating from the ribs, not from the costal cartilage. So here you can see pectoralis minor is originating from ribs. It is not originating from costal cartilage. So from which ribs it is originating? So that is important. Generally, it originates from third to fifth rib. Originates from third to fifth rib. And where it is going to insert? As you can see here, what is this? This is the coracoid process of scapula. So this is coracoid process of scapula. So it originates from the ribs and going to insert on the coracoid process of scapula. So which part of coracoid process? So it is inserting on coracoid process of scapula. Which part? Medial border and upper surface. It is going to insert on medial border and upper surface, medial border and upper surface of coracoid process of scapula. So this is about the origin and insertion of pectoralis minor muscle. Muscle you can see here, pectoralis minor muscles. Now the importance of this muscle should be remembered. This is the muscle which divides the axillary artery into three divisions. First part of axillary artery lies medial or above to pectoralis minor muscle. Second part of the axillary artery is just behind the pectoralis minor muscle, and third part is just below or lateral to pectoralis minor muscle. So it divides the axillary artery into three parts. So this is very important landmark to remember. Next important thing is it is covered by coraco. This muscle is covered by, here we have studied a fascia. Which fascia in the pectoral region? Clavipectoral fascia. So this muscle is covered by clavipectoral fascia, which starts from the inferior surface of the clavicle, enclosing the subclavius muscle, then it encloses the pectoralis minor muscle, then forms the suspensory ligament of axilla and continue with axillary fascia. So this is important about pectoralis minor. Let's move further. So here the important thing we can see is this is the pectoralis major muscle and here is the deltoid. So these are the two muscles which we can see here. This is pectoralis major muscle and this is deltoid. So in between pectoralis major muscle and deltoid, we can see one groove. So this groove you can see here. So this is very important groove known as deltopectoral groove. So this is deltopectoral groove between the pectoralis major muscle and deltoid. So the structure which is passing through this groove is a vein, cephalic vein. Cephalic vein passes through this groove along with some lymphatics. So this groove is very important. Now you can also observe a small triangle is forming. Here is the pectoralis major. So in between the pectoralis major and deltoid, this small area and a small triangle is formed here. The triangle is similar named as deltopectoral triangle. So these things should be remembered. Now in this figure we can mark the pectoralis minor origin and insertion. So pectoralis minor from the third, fourth and fifth rib, and this is the coracoid process. So medial border and upper surface of coracoid process. So this is the pectoralis minor from third, fourth and fifth ribs going up to the medial border and upper surface of coracoid process. This is pectoralis minor muscle. So we have discussed the origin, insertion and some of the importance about pectoralis major and pectoralis minor muscle. So let's move further. So guys, we have discussed about origin and insertions. Now we will discuss about innervation of these muscles. So how these muscles are innervated? So the muscle is innervated by brachial plexus. Brachial plexus. So hope you have already studied something about brachial plexus, that brachial plexus is formed by ventral rami of a spinal nerve C5 to T1. C5 to T1. Okay. So these C5 to T1 first form the trunk, upper trunk, middle trunk and lower trunk. Then they form the divisions, anterior and posterior division. Each of these forms anterior and posterior division, and they finally form three chords: lateral chord, posterior chord, and medial chord. So the nerves supplying these muscles come from lateral cord and medial cord. The nerve coming from lateral cord is known as lateral pectoral nerve, lateral pectoral nerve, and nerve coming from medial cord is known as medial pectoral nerve. So these two muscles are supplied by both nerve, lateral pectoral nerve and medial pectoral nerve. But there is a difference, that medial pectoral nerve, which you seeing here, this is the medial pectoral nerve, which first pierces the pectoralis minor muscle, then it supplies the pectoralis major. So medial pectoral nerve, this nerve first pierces the pectoralis minor muscle, then supply major, then supply pectoralis major. Okay, but both muscle will be supplied by both nerves. And lateral pectoral nerve, this pierces the clavipectoral fascia. So it will be present in this region, lateral pectoral nerve. It will pierce the clavipectoral fascia and then it will supply the minor and also the major. Okay, so these two muscles will be supplied by both nerves, lateral pectoral and medial pectoral nerve. So what will be the root value of these nerves? So lateral pectoral nerve coming from lateral cord, so it will have the root value C5, C6 and C7. What about the medial cord? It will be formed by C8 and T1. So upper fibers of pectoralis major will be supplied by C5, C6, clavicular and manubrial fiber. Rest of the fiber will be supplied by C7, C8 and T1. So this is about the nerve supply of these muscles. Now we are left with one more muscle. What is that muscle? The small muscle, subclavius. So let's discuss about subclavius muscle. This is very small muscle. It originates from first rib just near the costal cartilage. So arises from first rib and insert on subclavian groove on the inferior surface of clavicle. So this is the subclavius muscle. Subclavius muscle originates from first rib near its costal cartilage and insert on the subclavian groove on the inferior surface of the clavicle. So this is the subclavius muscle and it is supplied by nerve to subclavius, which comes from upper trunk of brachial plexus. Upper trunk of brachial plexus having root value C5, C6. So this is very simple. Subclavius originates from first rib near its costal cartilage. Insert in the groove for subclavius on inferior surface of the clavicle, supplied by nerve to subclavius coming from upper trunk, and root value is C5, C6. So it is very simple. Now we will discuss something about blood supply of these muscles, which is not so important, but we can discuss the blood supply too. So the major arteries in this region will supply these muscles. So what are those major arteries? The most important artery is thoracoacromial artery. Thoracoacromial artery, which is a branch of second part of axillary artery. Branch of second part of axillary artery. Axillary artery. By its pectoral branch, thoracoacromial artery have the four branches. By the pectoral branch, it supply the pectoral muscles. Apart from this artery, there is superior thoracic artery and lateral thoracic artery also supply these muscles. Superior thoracic artery and lateral thoracic artery. Lateral thoracic artery. So this is about something about blood supply. Okay. So we have discussed about the origin, insertion, nerve supply and blood supply. Now we can discuss about action of these muscles. Actions. So first about pectoralis major. So pectoralis major has two fiber, clavicular fiber and sternal fiber. So clavicular fiber, as it is above as compared to sternal fiber, it will help in flexion. So there will be flexion. Also it will help in rotation, medial rotation, and together these two fiber causes adduction of the shoulder joint. So the major action of pectoralis major is flexion, medial rotation and also the adduction. So these are the three major actions. Also when the humerus is fixed to the side, the pectoralis major acts as respiratory muscle for the inspiration. So it acts as inspiratory muscle also. So helps in inspiration. Pectoralis major when the humerus is fixed by the side. So these are some of the action of pectoralis major muscle. So now coming to pectoralis minor. Pectoralis minor. So pectoralis minor muscle, as it is going to insert on the scapula, its help in protraction of scapula, means scapula is moved forward towards the chest wall along with serratus anterior. So it helps in protraction of scapula. It can act as accessory muscle of inspiration also. So it also helps in inspiration. Okay, what about subclavius muscle? So this is small muscle, subclavius. So it steadies the clavicle. Steadies clavicle during the rotatory movement during overhead abduction. It steadies the clavicle at its place. Second, it also stabilizes the saddle joint between the sternum and clavicle. Sternoclavicular joint, which is a saddle joint. So this muscle also helps in stabilizing this sternoclavicular joint. So these are the two actions of the subclavius muscle. Let's move forward. There is one clinical point regarding pectoralis major muscle. In some of the syndromic patients, this muscle is absent, either one-sided or both-sided, along with some other structures which may have some congenital abnormality. So this is known as Poland syndrome, where the muscle, pectoralis major muscle of one side is underdeveloped or absent. So we should look for other abnormality in these type of cases. So this is about one of the syndrome known as Poland syndrome related to pectoralis major muscle. One more important thing is sometimes we can get a small strip of muscle anterior to pectoralis major near the sternum. Just near this region, we may find one muscle which is going down vertically. This is known as rectus sternalis. Rectus sternalis. It is present in very few people. It may be an extension of rectus abdominis muscle in the thoracic wall. So these are some of the clinical relevant points. So we have discussed about pectoralis major muscle, minor muscle and subclavius muscle. We have discussed its nerve supply, attachment, blood supply and also the actions. And finally we have discussed the clinical points. You can refer these books for further more detailed description about pectoral region. Hope you have understood well. So friends, hope you have understood well about the pectoral muscle. So keep visiting my site and keep liking and keep sharing the videos. I will be coming with further videos of the upper limbs, discuss about the muscles in more detail. Thank you so much for learning and watching my videos. Keep liking.